occupational health, your pronouns, and then take it away.
Hi, I am Jessica Estrada. I use she, her pronouns. I am the Director of Nursing and Medical Support here at Whitman-Walker, and today I am talking about our occupational health programs. So we'll talk a little bit about the different services that we have in occupational health and some of our changes in response to COVID-19 and personal protective equipment, cloth face coverings, and what is required when individuals are on site. So first, a little bit about what services we're offering in terms of occupational health. Everyone should have already had their initial TB screening. We will also be doing an annual symptom screening and education that all employees and non-employees need to complete. In addition, we work through the vaccines and review vaccine records for employees and non-employees that are credentialed. Those are typically licensed clinicians that are credentialed. So you should have already heard from us on that one as well. We will have a separate bloodborne pathogens training for those of you that are potentially at risk of a bloodborne pathogen exposure, but I do want everyone to have a basic understanding of what we would want you to do if you were to have a needle stick or a blood splatter in your eye or other mucous membranes. So what we want is for you to wash the site immediately if it happens. That means if it's on your hand or other exposed area of skin, that you would wash your hands with soap and water, and that if it's a blood splatter to the eye, that you use one of our eye wash stations. Again, those should be clearly marked. They are on the medical floors and in all of our facilities. We will then, after you've cleaned the site, I ask that you contact occupational health as soon as possible, because we do want to help people assess their risk of potential bloodborne pathogens, and that we want to offer post-exposure prophylaxis if that is necessary. I want to go through a few slides that Dr. Hen, our Chief Health Officer, presented to all staff in the fall of 2020. This is the scientific update for COVID-19 and how the science has informed what we're doing here. So one thing is we do have universal masking. I'll talk a little bit more about that in the next slide, but there is evidence that shows that masking is working. We know from a JAMA article in July of 2020 that there were infection rates among some healthcare workers that they were actually increasing, even though those healthcare workers were using proper PPE when they were with someone that was known or suspected of having COVID. Once they had everyone, all employees, wear masks, they saw a rapid decline in the infection rates among healthcare workers. We also have a MMWR from CDC that's a case study of more cloth face coverings in a non-healthcare setting. This was a hairstylist was infected with COVID. They went to work and with symptoms for about 5 days. They did not wear a mask around the other hairstylist, so they also developed COVID. But with all of their clients, both the client and the hairstylist were wearing either a cloth face covering or a procedure mask. And these were the exposure risk that the time matters. So they were at least 15-minute appointments, and none of the clients ended up getting COVID. So we know that in a lot of settings, masks really are working. So that helps us provide some information that we are using universal masking at Whitman-Walker as well. So surgical masks and cloth face coverings protect against respiratory droplet transmission. Those N95s also are going to protect against aerosols. We have eliminated most of our aerosol generating procedures on site, but there are still a few that are happening in dental, so they're using those N95s as appropriate. There are two types of masks that we do not want any patients or staff wearing on site. Those are those vented masks, the big red X in the middle with the 3 individuals in that picture. That's because they don't protect the other people around us. They're really intended for construction, not in a healthcare infection control setting. Neck gaiters, there's also new evidence showing that they aren't providing the same protection that we originally would have thought. So we don't want those on site either. I wanted to also just review a couple of important aspects of wearing a face covering, that we wash our hands before and after putting the mask on, and when we take it off, so that proper hand hygiene. Hand sanitizer is also okay. We need it to cover both the nose and the mouth in order for it to be effective. So no ear dangling or on our chin or below the nose. And that, I need to pause for a second, Niall.
Okay.
I don't remember the other thing.
Okay. And we also, it's important to know that cloth face coverings aren't considered personal protective equipment where the other N95s and the surgical or procedure face masks are. So I have a question. With those face coverings, so I'm working in a department, I work in the PBIN department, and I haven't had to come on site yet. Do I have to wear that every time I come on site, and are there places for me to pick up an approved mask if I forget mine?
Yes, the answer is yes to all of the above. We do require that everyone wear a cloth face covering or a procedure mask when they are in any of our facilities. We do have some available for staff as well as patients if they're wearing one that is one of those neck gaiters or that's visibly torn or soiled. So they're at the front entrance, also on the medical floors and in the mailroom at Liz. If there's any time that you're unable to find one, we do have masks, so please let Occ Health know, and we can help find someone that can ensure that it is where you can access it.
And if I see a patient that has a neck gaiter on, am I supposed to call Occupational Health, or do I give them the mask? How does that work?
We ask that staff all feel that they can ask the patient to switch masks, that we offer them the ear loop masks that we have available, and that while they're in the building that they need to wear the mask that we're providing. And unfortunately, if they refuse, then we won't be able to see them that day.
Okay, thank you.
So this is a slide about kind of what risk level we're seeing when someone has COVID and they're not wearing a mask and the person they're around isn't wearing one, and how that social distancing impacts as well. So right now, we believe that there's about a 15% transmission rate when we're not distancing, so at least 6 feet apart, and we're not wearing a face covering. But when we get to both people wearing face coverings, but they're still not distancing, it's about a 1% transmission rate.
But if both people are wearing a face covering and are socially distanced, then it looks like it's about less than 1% transmission. This is kind of reminds us about the different levels of risk and the things to think about in any situation that we each want to participate in. It's important to think about if it's outside or if we're going to be inside, how long the interaction will be, how many people, and how easy it is to maintain physical distance of 6 feet or more, and also if there's going to be sneezing, yelling, singing, or coughing. That's also forceful exhalation. Because we do know that COVID is transmitted through talking, sneezing, yelling, singing, and coughing. So the lower risk are going to be things where we're either by ourselves or with one other person and they're outside and we're wearing our masks. Those higher risks are concerts, bars, inside parties, those types of things. And then there's everything in between. And we do what we can to help prevent, to help move it from kind of that medium risk and what can we do to make everyone as safe as possible.
So I have a question.
Yep. Do
we offer that information to the public? Like if I wanted to share that slide with people here in my household, would that be okay? Does Whitman-Walker offer that information to the public?
We have done a few things through like Instagram Live and other social media. This wasn't actually a Whitman-Walker slide originally. It came from another from University of Pennsylvania. So I think we could access where we got this one and share that for sure.
Great, thank you.
And at this point with respiratory illnesses, especially, I'm recording in September, so it's flu season's coming upon us. So remembering that always using proper hand hygiene is super important to prevent illness. Hand sanitizer or soap and water. Gloves are not a substitute for hand hygiene. So they really 20 seconds of good scrubbing the hands with in between fingers, fronts and backs of hands, under those fingernails is what we should be doing to help prevent respiratory illnesses. So moving to some of the changes that occupational health has implemented since COVID-19 started. We are now doing a daily symptom screening or a daily health screening for anyone coming on site to one of our facilities. So we are using a program called Alert Media. It is also what Whitman-Walker uses for a lot of our emergency communications. And it simply asks if you've had any of the COVID symptoms. It lists as current symptoms from the CDC website on that. And we send it either through an application or through, through an email. We're asking that non-employees, the volunteers also complete that if they're coming on site more than once per month, or if you have a Whitman-Walker ID, network ID. So if we're going to be giving you access to email through Whitman-Walker. Also, for those folks that don't have a Whitman-Walker network ID or that are on site less frequently, we do have another form that is available that we are putting into DocuSign and will get emailed out. So we'll need you to alert your program sponsor as well as occupational health. At the end of the slides, I will give you our email address and we will make sure that that form gets to you, and we'll just need it back before you come on site. When you feel unwell, so if you have any of the symptoms or you are just generally not feeling well, please don't come to a Whitman-Walker facility. It's really important for infection control that when any of us aren't feeling our best, that we stay home. And here's our minimum personal protective equipment requirements chart. Kind of goes through some of the different tasks or patient and other staff encounters that we would expect, and that what PPE we are requiring staff to wear and our non-employees. So essentially, whenever you're in a building and in a Whitman-Walker facility as well, if it's a shared workspace, we need to be wearing a face mask or a face covering our nose and mouth. We understand that people will need to eat and take those masks off, but in those moments, they need to be at least 6 feet from all other individuals. Then when we are with a patient that we are not using those cloth face coverings, they need to wear a procedure surgical mask as well as eye protection. And then of course, putting on gloves and gowns and switching to the filtering respirator as necessary based on the situation. That is all I had. So if anyone has any questions, you can reach out to the nurse manager for occupational health, who is conveniently also named Jessica, or contact us at ochealth@whitman-walker.org. Thank you.
Okay.